Hello, I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Captain Heidi Blank, CDC's Chief for Obesity Prevention and Control. Welcome, Heidi.
Thanks for having me.
At today's Grand Round session, we focused on childhood obesity prevention. What can you tell our audience about the scope of this problem and how we define it?
Obesity is a disorder of excess body fat, and in adults and children, we use a measure called body mass index, or BMI, and it's actually a simple equation of weight divided by height squared. So as a screening measure in the doctor's office or in schools or in other settings, it's pretty simple to actually identify children who have obesity or are at risk for obesity. Unfortunately, in today's country, we have about 1 in 5 children already struggling with obesity.
So that's obviously clearly a population health issue. I think some of our audience may be familiar with some of the eventual complications such as type 2 diabetes, but there's really a much longer list of risks of obesity. Could you just kind of take us quickly sort of head to toe on that?
So in childhood, when children have obesity, they already are at risk for a number of acute conditions. Some of these are structural, like bone problems or sleep apnea. There's also mental health issues with children, including bullying and stigmatization. We see increased absenteeism from school. If obesity continues and is persistent and it goes into adulthood, as you mentioned, type 2 diabetes is a large concern of obesity, but also cardiovascular disease. And we now have 13 cancers that are causally linked to obesity.
Yeah, so that certainly is something that I think is many of our audience are likely unaware of, and I think that's very sobering. What do we know about the need to really intervene during childhood, and particularly earlier in childhood, in terms of maybe our population is just sort of going to grow out of this problem?
Yeah, so I've been to a lot of places in the communities across America, and I hear from a lot of parents who think their children are just going through a stage, that they're going to grow out of this. But unfortunately, we have a bulk of evidence and data from our national surveys, as well as modeling exercises that really show children are on a trajectory toward obesity. So we used to think obesity was an adult onset disease. We're now seeing children as young as 2, 3, and 4 having obesity.
Again, very sobering. Now, a lot of the focus in our session was on the early childhood education, or what we'll refer to as the child care setting. So why is that setting important for obesity prevention, and what can parents and child care providers do to have an impact in that setting?
So we know that a large number of our children spend their days outside the home. So over 60% of our toddlers are in child care for over 30 hours a week. So although parents and aunts and uncles and grandparents are very important in the household setting, our child care providers really are that first line of defense and first line of healthy habits during that school week. We have a lot of children who are benefiting from high-quality child care for school readiness and early literacy, but we really need to make sure, too, that those healthy habits are established during that child care day.
And so what are some of those targets, which are not only targets for child care? What are some of those targets in terms of physical activity and healthy nutrition?
So we know that obesity is not a simple disease. There are many factors that cause obesity. So the science is evolving, but we know that better foods, so those that are lower in calorie and high in nutrients, so things like fruits and vegetables, getting adequate physical activity, reducing screen time or sedentary time, but also stress management and sleep are really important in children. A lot of initiatives these days use something like a 10-5-2-1-0 approach. So 10 hours of sleep, 5 fruits and vegetables, less than 2 hours of screen time, 1 hour of physical activity, and 0 sugary drinks.
That's really a great way to remember that, because I think that applies across a pretty wide range of ages as well. Yes. So clearly, there's a lot of impact that child care providers can have, that parents can have outside of the school day as well. Obviously, as kids age, they continue to spend a lot of time in school settings. CDC does have some school guidelines, and although they're not solely focused on obesity prevention, I think they're relevant. Could you just hit for our audience some of the high points of those guidelines?
Yes, so the school health guidelines really provide a comprehensive set of standards and best practices that schools can really aim for. So some of it are around the areas that we talked about, but it also includes nutrition education, nutrition services, and that nutrition environment. So that includes the school day, the after school, the campus. So again, ensuring healthier foods, drinking water availability, physical activity throughout the school day. So in sometimes that can be actually kind of active recess in addition to some activity breaks during that school day or as part of lessons. Also, we are related to food service directors, and the Healthy School Guidelines really do fit into this whole child, whole community model. So really trying to think about the parents, the community, and the child, and how that really fits together in our society.
Right. Certainly, we not only want active and healthy children, we want active and healthy parents and families. And communities as well, and certainly we had speakers at Grand Rounds who really addressed different aspects of all of that. So you gave us some really fairly sobering statistics earlier about the current amount of childhood obesity and some of the complications that might ensue and some of the kind of trajectories that we're on. I think there is, though, some basis for optimism in some of the data about from childcare settings. Could you kind of walk us through that and maybe talk a little bit about what has led to some of those positive outcomes?
So the CDC has a partnership with the USDA, the United States Department of Agriculture, and we've released a report that shows among the low-income children in our population, those who are probably the most vulnerable for obesity. So the 2 to 4-year-olds, actually we've seen a decrease in obesity since 2010. So this is really exciting. It's a very large data set, so it provides some robustness around our data and our estimates. And this really gives us hope that, that society, communities, families are starting to move in the right direction.
And so is it likely that approaches like that 10-5-2-1-0 approach could those be some of the underlying factors beyond these improvements?
So yeah, so we've done some analyses along with partners to look at least 4 communities that found childhood obesity declines, and that's helped us kind of provide some information of why we think the WIC population, why that data is showing that decline. Some of the things that we're seeing some changes in the right direction include many more child care providers and many more child care settings that are meeting best practices. So again, around breastfeeding supports for moms, healthy nutrition and snacks, especially infant feeding. We're seeing a lot of early infant weight gain among American children. This really includes things like early introduction of foods, moms not being able to really meet their breastfeeding intent, so early formula feeding, and parenting styles. And so child care providers are really working with parents to ensure that parents have that best knowledge and that the child care providers are doing the right thing. And so we're seeing things like state policies that are supporting the child care center. We're seeing that in schools as well. So if you layer on kind of state policies and state initiatives, district or school level and child care provider level positive movements, and then the community at large. So we're seeing park and recreation facilities offering programs, improving their vending, really getting kids and multi-generations involved. And so it really takes all those layers to make a difference, because we go through our days in many key settings. Again, we leave our houses, we go to these places, whether it's work sites for parents or the child care in the school. So it's really taking these levels of policy change, environmental change, and individual habits. And we think all of that is kind of coming together to really change this.
So that's really important. I think we also had some examples presented of linking childcare with farmers markets, for example, which I thought was a good example of a community linkage. So I think almost everyone in our audience will have some role, either as a parent, a teacher, a school administrator, a school board member, just an interested or engaged community member. Where are some places they can go to find more resources?
In addition to our own site, which has obesity and has nutrition and physical activity strategies, many of our states and local communities have community coalitions. Some of these are healthy eating, active living type coalitions. We also have school wellness and PTA membership. And so many folks who are interested in this really can get involved. We're happy to put folks in contact with a number of our organizations at the state and territorial level as well.
Well, and on that note of really everybody being able to have some role in this, I'd like to again thank you very much for your work and for speaking with us today.
Thank you.
I'm Dr. John Iskander. Please join us next time for Beyond the Data.